As of today, we have 221,258 cases, 1,504 new cases reported since yesterday, 1,013 people in the hospital, and sadly, 3,670 people who've died. We mourn with those who've lost loved ones, and we pray for strength for those fighting this disease. Today, we're pleased to announce another investment in child care to help families and children and our early learning teachers. Licensed facilities that are providing in-person child care from August to October are eligible for $35 million in grants to keep kids in a safe and nurturing environment and allow their parents to go to work or to school. The grants will help offset the significant financial strains placed on child care to meet health and safety guidelines while serving fewer children. Our child care programs have been on the front line since the start of this pandemic, keeping their doors open so other workers could keep our economy running and our public safe. A strong and safe child care system is essential to our recovery. Education and child care have to remain a priority even as we fight this pandemic, and these funds will help child care centers keep welcoming children to safe and caring places. Already, the Department of Health and Human Services has provided $80 million to these centers to make child care available to more than 100,000 children since the start of the pandemic. I really want to thank our early childhood teachers for all they do every day for young children and our families across the state. We're also working to get small businesses financial help dealing with the effects of the pandemic. Hundreds have already applied, and the Department of Commerce expects to make the first allocations next week. At the same time, we remain concerned about how case numbers are growing across the nation and how that wrong direction might affect us here in North Carolina. We North Carolinians need to act responsibly and protect our loved ones by always wearing masks and keeping distant when we're together. And it's going to take all of us working together to succeed. The time to do that is now. Day in and day out, the virus is seizing opportunities to spread. The most dangerous time is when people drop their guard and think this isn't serious. As we saw in Washington over the weekend, the virus is quick to spread and many times slow to leave. This virus is unpredictable and deadly serious. Just in the past month, here in North Carolina, we've lost a college student, a teacher, beloved members of a firefighting community, and many others to this cruel disease. Our methodical approach to easing restrictions will work safely if we keep using proven measures, wearing a mask, waiting 6 feet apart, and washing our hands often. Other important work in fighting the virus is going on across the state, and I'm going to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to give us an update. Dr. Cohen?
Thank you, Governor. I appreciate your steadfast leadership. Your measured approach based on the science and data has put us on solid ground throughout this crisis. Thank you for working to find a balance that allows us to live with this virus, protecting the public's health and reigniting the economy. Let me begin my update with talking about our testing efforts. First, we continue to ramp up testing around the state with more than 430 free testing events planned in communities across this state in the month of October, with more added every day. Anyone who has symptoms or think they have been exposed to COVID-19 can get tested. You don't need to have insurance. These testing sites are free, and you can find one at ncdhhs.gov/testingplace. These free testing events add to the more than 600 testing sites across the state. Make sure you're accessing testing. Again, anyone with symptoms or who thinks they could have been exposed to COVID should get a test. We also have more testing coming into the state from the federal government. Yesterday, we received 200,000 rapid antigen tests and expect to receive a total of 3 million of these tests by the end of the year. The state will begin an initial distribution of these tests to 52 high-priority counties through our local health departments. These tests are designed to provide a quick result for people with symptoms, similar to a rapid flu or a rapid strep test that you might get at an urgent care or a doctor's office. These tests will be free to the patient and will be deployed by the local health department to outbreaks in schools and farm worker camps, food processing plants, homeless shelters, first responders, colleges and universities, and correctional facilities. And while testing is important, it is insufficient on its own. It's those 3 W's that make the biggest difference. Those are the tools we need to use every single day, every single time we leave the house, so we can protect our friends and neighbors and keep virus levels low. As people move around more, there are more opportunities for this virus to spread. We are seeing this in our trends, which have moved in the wrong direction over the past week. Our cases have ticked up, as have the percent of tests that are positive and hospitalizations. We can turn these trends around just as we have throughout this pandemic by relying on the science. Wearing a mask properly slows the spread. Waiting 6 feet apart from other people and avoiding large crowds slows the spread. Washing your hands frequently for at least 20 seconds with soap and water slows the spread. Doing them all together will keep us on the right track, particularly as we head into flu season. So let's do the things we can to protect ourselves and our loved ones, including getting your flu shot. The flu vaccine is the single best way to prevent the flu and its complications. It lowers your likelihood of getting sick, and if you do catch the flu, it's likely to be milder than if you weren't vaccinated. So before I turn it back over to the governor, I want to remind everyone that we're not powerless in the face of this pandemic. We can slow the spread and support North Carolina's recovery. Just wear, wait, and wash, and whatever your reason, get behind the mask. Thank you, Governor.
Thank you, Dr. Cohen. I appreciate your leadership as well. On Friday, we entered phase 3 of easing restrictions, but this phase only works safely if we realize that every gathering carries the risk of spreading this disease, and we treat it that way. If we're going out, let's do what works. Wear a mask, keep social distancing, wash your hands often, and stay away from places where people aren't doing that. Precautions like the 3 W's help children get back into classrooms and move our economy forward. Along with Secretary Cohen, also with me today is Emergency Management Director Mike Sprayberry. Karen Magoon and Brian Tipton are our sign language interpreters. Behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We also have our Secretary of the Department of Public Safety, Eric Hooks, who has joined us as well. We'll now open it up for questions that you might have, and we would ask you to...